Hi class. I chose the topic of LGBT youth. Um, I wanted to talk about what it might be like to raise an LGBT child and how you can support your child. Let's go on to the second slide. What is LGBTQ+. LGBTQ+ stands for lesbian, gay, bisexual, transgender, queer, and more. There's tons of identities that fit in between all of these definitions, and that would include a variety of gender identities and sexualities, as well as asexuality. It's basically a community of marginalized individuals who are not cisgender or straight. Cisgender would be someone who identifies as the gender that they were assigned at birth, and straight would be someone who's attracted to the opposite sex. Moving on to slide number 3. What do I do if my child is LGBTQ+? So those who are LGBTQ+ are a lot more susceptible to mental health struggles and suicide. This is greatly due to often being rejected and having a lack of support at home. So it's very important that you listen to your child and you allow them the space to communicate their needs to you. Of course, if you provide them the tools like language that they can use to communicate how they feel, and just giving them space, if letting them know if they want to talk that you're there, but also allowing them to process their own feelings. And also just showing your child that they can talk to you about things rather than being reactive or making negative comments. You should really try to be a very neutral and also supportive person in their life that they can come to talk about these things with. Moving on to number 4. What do I do if my child is transgender? This is a little bit different than if they come out to you as gay or bisexual or asexual, because it may involve treatment of dysphoria. So you would want to reach out to an LGBT-friendly doctor/therapist, so they can talk to a therapist and let the therapist know how they feel, whether they're experiencing dysphoria or not, what their plan of treatment might be for the future, whether it would be beneficial to go on puberty blockers. All of these things are very important to discuss with the doctor and therapist. You can also find support groups for both parents and children for transgender youth. This way you can talk to other parents about how you feel. You can ask questions from other people that have experienced these things. If you have concerns about any kind of treatment, you can talk to other parents, other professionals. And of course, if you're having conflicting feelings about your child coming out to you, you should always talk about these things with other adults, not put that onto your child. It's best to be positive and supportive towards your child for their own mental health. Moving on to slide number 5. Or how can I support my child? Just in general, it helps if you support and participate in the LGBTQ community. So this means maybe going to pride events, maybe going to social groups, donating to trans and LGBT groups, showing your child that it's important to you, that their identity is important to you and that you respect them. On that note, it's important to use their preferred pronouns and names. Sometimes people will have to go through trial and error, and they might choose a name or an identity that doesn't fit them in the long run, but it doesn't hurt them to explore this and experiment with this. So it's in their best interest if you follow their lead and listen to them and respect how they feel in the moment. And allow them to express themselves and choose how they present. So it's not going to help your child if you're forcing them to wear dresses because you want them to be more feminine, or if you're forcing them to wear anything that they don't want to wear. And lastly, I have listed some local resources, and that's all I have for my presentation. I hope that you learned something, and let me know if you have any other questions.